Good afternoon, folks. Now, today's topic B, we're talking about whole body MRIs and what the effects cause you later down the road. Okay, so here we go with presentation B for you. Title: Get a whole body MRI. Mistake that could affect your long-term health. Whole body MRI has become the latest symbol of health anxiety in America. A sleek, high-tech promise that if you scan everything, you can outmaneuver disease. Companies market these scans with cinematic flair, growing organs, glowing organs, futuristic imaging, sweets, and slogans about taking control of your health for a few $1,000s. They offer reassurance, empowerment, and the seductive idea that early detection is always good detection. But beneath the marketing lies a quieter truth for most healthy people. A whole body MRI is far more likely to create harm than benefits. The mistake isn't the technology itself. MRI is extraordinary when used appropriately. The mistake is believing that more imaging automatically leads to better health. In reality, whole body MRI can set off a chain reaction of false alarms, invasive procedures, anxiety, and overtreatments. That can shape a person's health trajectory for years. The seduction of early detection. The appeal is understandable. We live in a culture that fears cancer more than almost any other disease. We are told that catching things early saves lives. We are told that vigilance is a virtue. And we are told that technology can outsmart biology. Whole body MRI companies capitalize on this fear. Their messaging suggests that scanning the entire body is a form of responsible self-care, a way to stay ahead of illness. But this framing ignores the fundamental reality of medical science. Screening only works when the test is accurate. The disease is detectable early treatment improves outcomes. Whole body MRI fails on 3 counts. The cascade, how a single scan becomes a long-term burden. The biggest danger of whole body MRI isn't the scan itself. It is what happens next. Incidental amas. The findings that look scary but aren't. MRI is extinguishingly sensitive. It sees everything, including benign autonomous quirks that have lived quietly in your body for decades. These harmless variations often appear abnormal on imaging, and once they are discovered, they demand attention. A small liver cyst, a thyroid nodule, a spot on the adrenal gland, a shadow near the spine. Each one becomes a question mark. And in medicine, question marks trigger action. The downstream spiral. A single incidental finding can lead to repeated MRIs, CT scans, ultrasounds, specialist visits, biopsies, sometimes surgery. Every step carries risk: bleeding, infection, anesthesia, complications, long-term functional impacts, and all of it may be chasing something that was never dangerous. This is the paradox. Whole body MRI can turn healthy people into patients. Overdiagnosis when finding cancer doesn't help. One of the most misunderstood harms in modern medicine is overdiagnosis, detecting cancers that are real but irrelevant. Some tumors grow so slowly that they would never cause symptoms or shorten life. Treating them exposes people to chemotherapy, radiation, or surgery they never need. Whole body MRI is particularly prone to finding these low risk lesions. And once a cancer is named, even if it's indolent, the psychological and clinical momentum toward treatment is almost impossible to stop. The psychological toll. People who undergo whole body MRI often describe the aftermath as a period of diagnostic limbo. They wait for results. They wait for follow up scans. They wait for specialists. They wait for biopsies. They wait for pathology reports. Weeks turn into months. The anxiety becomes its own illness, a chronic looping fear that something terrible is hiding in the body, even when something turns out benign. The emotional residue lingers, the financial toxicity. Whole body MRI is expensive, typically $1,299 to $4,000 out of pocket, but the real cost comes afterward. Follow up in imaging, specialist consultation, procedures, and surveillance can multiply the financial burden, especially when insurance declines coverage for tests triggered by non recommended screening. For many families, this cascade becomes a source of long term financial strain. The false sense of security, perhaps the most subtle harm, is the illusion of safety. A normal whole body MRI can make people believe they are cleared of disease, but MRI cannot reliably detect early colorectal cancer, early lung cancer, metabolic disease, cardiovascular risk, most small or early stage malignancies. It's information without context and sometimes without value. Why targeted imaging is different. MRI is extraordinary when used for the right reasons. A specific symptom, a known risk factor, a defined organ origin of concern. In these cases, MRI can diagnose, clarify, and guide treatment, but scanning the whole entire body at once does not improve survival. Even when cancer is found, there is no evidence that whole body MRI helps people live longer. The long term health mistake. The mistake isn't curiosity, it isn't uh, wanting reassurance, it isn't wanting to be proactive. This the mistake is believing that that whole body MRI is a shortcut to safety. That more information is always better. That technology can eliminate uncertainty, and that early detection is inherently protective. In truth, whole body MRI often creates more harm than benefit, detects things that don't matter, misses things that do, costs thousands, triggers procedures with real medical risk. It is a test that feels empowering, but frequently disempowers. It promises clarity, but often creates confusion. A better path toward the real work of long term care or long term health isn't in scanning everything, it is in evidence based screening, managing known risk factors, building relationships with clinicians, understanding what tests can and cannot be, or cannot do, resisting the cultural pressure to medicalize normal life. Whole body MRI is a technological solution to an emotional problem, our fear of the unknown. But fear is not a diagnosis, and reassurance is not a treatment plan. The most powerful thing we can do is choose care that is grounded in evidence, not marketing, in wisdom, not worry, in partnership, not panic. Okay, guys, that's B for you. I'm going to take a little break. I'll be back on for C shortly. Give me a little bit for a break, please. And I will be back on with you shortly. For now, Gator Wellness. Take care, folks.